Language and the brain. Where is the ability to use language located? The obvious answer is in the brain. However, it can be just anywhere in the brain. The ability to talk was unimpaired and hence clearly located somewhere else in the brain. Although this is a relatively recent term, the field of study dates back to the 19th century. The study about relationship between language and the brain, we called it neurolinguistics. The study started when Venus P.K. got an accident in September 1848 and his brain got damaged and he was still can talk and no damage on his sense of speech. The point of this rather amazing tale is that while language may be located in the brain, it clearly not situated right at the front. Language areas in the brain are Broca's area, Wernicke area, the motor cortex and the arcuate fasciculus, and the localization view. Broca's area, region of the brain that contains neurons involved in speech function. This area, located in the frontal part of the left hemisphere of the brain, discovered by French surgeon Paul Broca in 1861, found that it served a vital role in the generation of articulate speech. This finding was used to argue that language ability must be located in the left hemisphere and since then has been treated as an indication that Broca is crucially involved in the production of speech. Wernicke's area, region of the brain that contains motor neurons involved in the comprehension of speech. The Wernicke area is located in the posterior third of the upper temporal convolution of the left hemisphere. Thus, it lies close to the auditory cortex. This area appears to be uniquely important for the comprehension of speech, sound, and is considered to be the receptive language or language comprehension. Karl Wernicke, who was a German doctor, confirmed that the left hemisphere location of language ability, and led to the view that Wernicke's area is part of the brain that crucially involved in the understanding of speech. The motor cortex and the arcuate fasciculus. The motor cortex is an area that generally controls movement of the muscles. Close to Broca's area is the part of the motor cortex that controls of the face, jaw, tongue, and larynx. Reported by two neurosurgeons, Penfield and Roberts, motor cortex involved in the physical articulation of speech. Arcuate fasciculus. Arcuate fasciculus is now known to form a crucial connection between Wernicke's and Broca's area. The localization view. Since the first report of an aphasic patient by Paul Broca, the localization of brain function has been disputed for 150 years. In lesion studies, double dissociation has been a key concept to show the localization of particular cognitive functions. The advancement of non-invasive brain imaging methods enables us to investigate the brain activities under well-controlled conditions, further promoting the studies and the localization of the cognitive function, including language function. The tip of the tongue phenomenon and slips of the tongue. The tip of the tongue TUT phenomenon is a state in which one cannot quite recall a familiar word but can recall words of similar form and meaning. Several hundred such states were precipitated by reading to as the definition of English words of low frequency and asking them to try to recall the words. It was demonstrated that while in the TUT states and before recall occurred, S had knowledge of some of the letters in the missing word, the number of syllables in it, and the location of the primary stress. Slips of the tongue. Slips of the tongue are almost inevitable. For every 1,000 words spoken, we make 1 or 2 errors. Considering that the average pace of speech is 150 words a minute, a slip is bound to occur about once every 7 minutes of continuous talk. Each day, most of us make somewhere between 7 and 22 verbal slips. If you have experienced any of the slips on occasion, then you will have some hint of the types of experience that have some people live with constantly. Those people suffer from different types of language disorders, generally described as aphasia. The classification of different types of aphasia is usually based on the primary symptoms of someone having difficulties with language. Aphasias are Broca's aphasia, Wernicke's aphasia, and conduction aphasia. Broca's aphasia. Individuals with Broca's aphasia have trouble speaking fluently, but their comprehension can be relatively preserved. This type of aphasia is also known as non-fluent or expressive aphasia. Broca's aphasia may refer that patients have difficulty producing grammatical sentences, and their speech is limited mainly to short utterance of less than 4 words. Producing the right sounds or finding the right words is often a laborious process. Some persons have more difficulty using verbs than using nouns. Difficulties of finding the correct words referred to as anomia. Anomia also happens in Wernicke's aphasia. To overcome their words, speakers use different strategies such as trying to describe objects or talking about their purpose. Wernicke's aphasia. In this form of aphasia, the ability to grasp the meaning of spoken words and sentences is impaired. While the ease of producing connected speech is not very affected, therefore, Wernicke's aphasia is also referred as fluent aphasia or receptive aphasia. Reading and writing are often severely impaired. As in other forms of aphasia, individuals can have completely preserved intellectual and cognitive capabilities unrelated to speech and language. One other, much less common, type of aphasia has been associated with damage to the arcuate fasciculus, and it's called conduction aphasia, a type of fluent aphasia with prominent impairment with repetition. Damage typically involves the arcuate fasciculus and the left parietal region. The patient may be able to express him or herself very well, with some word-finding issues, and comprehension can be functional. They are fluent, but may have disrupted rhythm because of pauses and hesitations. Decodec listening, an experimental technique that has demonstrated a left hemisphere dominance for syllable and word processing, is called the decodec listening test. A physiological test commonly used to investigate selective attention within the auditory system and is a subtopic of cognitive psychology and neuroscience. Specifically, it is used as a behavioral test for hemispheric lateralization of speech sound perception. During a standard decodec listening test, a participant is presented with two different auditory stimuli simultaneously.